When I look at YouTube or other blog posts, I see a lot of people saying not to get nose fillers. Doctor, do you share the same opinion as those other social media platforms?
In particular, among board-certified plastic surgeons, I've seen several videos saying you should never get a nose filler, but personally I think there are actually quite a few cases where nose fillers can be a good option. So in my opinion, there are generally three main points, and I'd like to talk about those today. Three cases where nose fillers are okay. First, there are people who want to raise their nasal bridge before getting nose surgery, so it's natural to be curious before getting nose surgery. Some people worry about what will happen if they raise their nasal bridge, whether their features will become too strong, if it will look awkward, or if they'll end up looking like an avatar. In those cases, you can try fillers before surgery to check the shape. I think it's definitely worth trying in that situation. I also think it's a good idea to see how your image might change. Next, the second case is when the nasal bridge is low, but there's no major issue with the tip of the nose. For example, when the condition of the nose tip is good. There aren't really any problems with the tip, and even the height is pretty decent. It's just the bridge that's low, especially if it just feels a bit sunken around the glabella area. In that case, it's worth trying it once. With filler, just using filler alone can produce really good results. So I recommend it in these kinds of cases as well. Of course, if the nasal bridge is extremely low, there may be cases where filler alone isn't enough to solve the problem. But if that's not the case, and only a small part of the nasal bridge is slightly low, I think it's definitely worth trying with filler. The third and final point is the aversion to silicone. Some people are afraid for psychological reasons, and there are also those who are very worried that it might look obvious. In these cases, you have no choice but to raise the nasal bridge. In such situations, I think it's still good to fill it in with filler. Next, there's a bit of a special case. We often perform non-implant rhinoplasty. Among these patients, quite a few choose this surgery because they have an aversion to silicone. However, many of these people tend to have poor nasal tip conditions. There are people with various issues like a hooked nose, long nose, short nose, upturned nose, bulbous nose, or problems with the nasolabial angle. For these cases, the nasal tip is addressed first with non-implant rhinoplasty. After that, if there are areas along the nasal bridge that are particularly low, those can be treated with fillers. Some people are quite surprised to learn that you can get fillers after having nose surgery, but it is possible. So in these three cases, I think nose filler procedures are actually very good.
Is it okay to get rhinoplasty after having fillers?
Of course. It's definitely possible to get rhinoplasty after having nose fillers, and the principle is to dissolve the filler first. So it's best to get the filler dissolving injection about 3 days to a week before the surgery. However, due to work or other circumstances, some people want to have the filler dissolved on the day of the surgery. Honestly, this isn't a big problem either. It's really fine. So just because you've had a nose filler doesn't mean you can't have nose surgery, and it also doesn't mean you absolutely have to dissolve the filler beforehand.
Can nose fillers cause contracture?
In my opinion, contracture caused by nose fillers is extremely rare. Yes, you can pretty much consider that such cases are almost non-existent.